Multiple sclerosis is a disease of the brain and spinal cord, or central nervous system. Each nerve is insulated and protected by myelin, a complex fatty substance. Myelin allows the nerve to transmit electrical impulses to and from the brain efficiently. In those with MS, the myelin is damaged and destroyed, but only in the central nervous system. The nerve impulses in the damaged areas no longer flow smoothly. The destruction, or demyelination as it's called, may occur in any part of the brain or spinal cord. Symptoms such as numbness, tingling, or blurred vision may be the first signs of MS. As demyelination progresses, a dense, hardened scar or sclerosis forms at each site. The formation of multiple scars or areas of sclerosis give the disease its name. In many cases, it is a progressive or degenerative disease and generally affects people between the ages of 15 and 40. But MS has been diagnosed in children as young as 2 years of age. There are an estimated 11,000 people currently living with MS in Alberta. Women are diagnosed 3 times as often as men. It is believed that MS is an autoimmune disease. There is some evidence that MS may be triggered by a common virus, and that certain people are more susceptible because of genetic factors. There is no evidence, however, that MS is directly inherited. There may also be an environmental component contributing to the onset of the disease. However, we still do not know that exact cause, and it is likely due to a complex combination of factors.
Well, the most common way that MS manifests is as a relapsing remitting disease, and that usually affects people between the ages of 20 and 40, and that's characterized by periods where there's inflammation and demyelination that occurs in the nervous system, producing a relapse or attack of symptoms. So some of the common symptoms that we see in MS are things like loss of vision or reduction in vision in one eye, double vision, sensory symptoms, sometimes weakness, incoordination, imbalance, problems with walking, problems with bowel or bladder dysfunction, sometimes pain, and fatigue can be a big part of MS. The other main type of MS at onset is something called primary progressive MS, and that's the type that tends to affect people when they're a little bit older, often over 40, and that's more of a gradual deterioration or a gradual progression of symptoms rather than attacks. Now, some people with relapsing remitting MS over time will develop a progressive form of the disease as well. There's kind of 3 aspects of treatment. One is treating any acute relapses or attacks, and the mainstay for many, many years has been the use of corticosteroids if those relapses are disabling. There's also disease-modifying therapies that seem to actually modify the disease course, but they are most effective and are used primarily in relapsing remitting disease if there are frequent relapses. The other part of MS management is symptomatic management, and that's trying to optimize function and minimize some of the troublesome symptoms of MS, and that's a combination of non-medication strategies, including exercise, and medications that address individual symptoms. I think exercise is probably one of the most important aspects of managing MS, and that comes from studies showing the benefit, but also just from anecdote, what I see in my patients, that probably it's one of the most important things somebody with MS can do